Thank you so much, everybody, for joining us for the TYSA orientation today. I'm going to start with just a brief introduction of some of the folks who you are going to hear from today on this call. I think many of us have already met, in other Zoom calls or in-person TYSA functions, maybe even briefly. But for a refresher, today you'll be hearing from Sean and myself are going to be doing a lot of this presentation. Sean Ghazala and I are each behavioral health managers in TYSA in SIPCW, which is the nonprofit organization that provides the backbone support and structure for TYSA. So in that role, Sean and I manage a lot of the different work groups that are part of TYSA and do a lot of the back-end work to kind of keep the structure and work and relationships going. We also have Stephen Chan with us. Stephen is our lead for evaluations and special projects that have anything to do with data. So a lot of the interventions and the work that we do in TYSA is based on the data we receive. And Stephen really helps us collect that data and organize it so it can inform our strategies. So he's going to be talking a lot or a little bit today about some of the data that informs our work. We'll also hear a little bit from Shanice, and Shanice has kind of a unique role here. Shanice actually started with us as a youth consultant for TYSA, and now she is part of our team as a special project assistant. So she's going to talk about some of the work we're doing with the youth consultants and that perspective. And we also have Adrienne Abadi with us, who is the executive director of Staten Island Partnership for Community Wellness, and is also involved in the TYSA Coalition and has been with us for by far the longest. So she's seen SIPCW and TYSA evolve quite a bit. So before we do any kind of groups or meetings with folks, we just like to set some group norms. A lot of this, will be us providing information about the coalition, but, through the course of our presentation, some questions and answers, might come up, especially, when we're talking about, some of the data and some of the issues, that have been guiding our work. So we just ask, if you feel compelled to share anything, that you speak from your own personal experience and or perceptions, and try not to make assumptions, that's the way that other folks in the room feel as well. We do want to make space for people to be heard. So if you hear something that that you maybe disagree with, we do want folks to feel like they can speak out about that. We just ask that it's done so, in a respectful tone and in a respectful way. We do ask that everybody remains muted when they're not sharing, just because we've all experienced how disruptive some of that extra noise can be on these calls. And please feel free to use the chat functions for questions. We are going to have time for Q&A at the end as well. So you'll have either of those opportunities. If you put a question in the chat, it might, depending on how the timing is going with our presentation and or the nature of the question, we may wait until the end to address it, but you can feel free to put it in, and if we're not able to address it at that moment, we'll acknowledge that, and let you know that it's going to be tabled. Any other group norms people can think of that are not reflected on here that they would feel comfortable seeing in this discussion? Okay. Let's move forward. So we want to get an idea of who's on the call with us, and let's see how many people we have in total. Okay, so we have, other than, it looks like 17, but I think 4 of us are from the SIPC. Well, we'll have to introduce ourselves anyway too, I suppose. You know what, I think we do have I think we have enough time for this. We have an hour and a half today. So very briefly, if we can, and I will call out the first person, and then you can call out somebody else on the call, and we can go around that way. But just name, and when we say, what groups do you represent, some of you might come here in multiple hats. Some of you might have a hat on you that's not reflected on here. And that's okay. You can just, say like, hey, I'm here in this role, or I'm here as a community member, who wants to know more. It doesn't have to be reflected in these examples, but these are kind of like the main different hats, people wear when they come here, right? And if it's multiple, you can name those different types as well. So I can start. I'm Ashley Owen. I am here because I am part of the backbone organization, SIPCW, which I'll talk more about in a few minutes, that helps manage TYSA and brings everything together. So I will pass it to Kat.
Hi, I'm Kat Santacola. I work at Venture House on Staten Island. We are a clubhouse for adults with mental illness, and we do service a lot of co-occurring disorders. I run a co-occurring group here called Double Trouble. Yeah.
Awesome.
I gotta pass it. I'm gonna pass it to Liam.
Hi, I'm Liam. I'm a member at Venture House, and I'm also enrolled in the Academy of Peer Services. I'm hoping to become a peer specialist. I've also volunteered at the Pride Center on Staten Island, and yeah, I'm a community member, I suppose. And yeah, I'll pass it to Sean just because I see his name next on the screen. So,
thanks, Liam. Hi, all. Sean Gazala. I am the other behavioral health manager. I co-manage this project with Ashley. I work at the Staten Island Partnership for Community Wellness. So I represent the backbone organization, but I'm also a community member and a caregiver of young people myself as a godfather of young people. And I'm going to pass it to folks in the room with me. I'm going to pass it to Adrian.
Okay. Oh, okay. Hi, we're testing different hybrid concepts, so we're talking to our OWL speaker. So I'm Adrian Abadi. I am the executive director of the Staten Island Partnership for Community Wellness. I wear many hats. I'm the parent of 2 New York City DOE high school students. I live in Tompkinsville. I'm a doctoral student at CSI in their community-based leadership program, and I'm an active member of the nonprofit Staten Island board. So bringing lots of different roles into the work of SIPCW. And I'll pass it to Stephen.
Hi, good morning, everyone. I'm Stephen Shen. I'm Senior Lead for Evaluation and Special Projects here at SIPCW. I am part of the backbone staff. I don't think I fit neatly into any of these particular buckets, but I support several of them through my work on this team, though. I stepped out for just a second, but then so hopefully I pass it to a person that hasn't gone yet. I'm going to pass it to Kat.
No, try one more time.
Oh, Nicole.
Hi, my name is Nicole Muley. I work for the Pride Center of Staten Island. Was very excited to hear us mentioned already. Thank you, Liam. And so we are obviously an LGBT supporting organization, but we also offer youth services and mental health treatment services. So I will pass it to, let me scroll through quick. I will pass it to coincidentally, my colleague Haley.
Thanks, Nicole. I'm Haley Dawson. I use they, them, their pronouns, and I'm the behavioral health manager at the Pride Center. Like Nicole mentioned, we serve the LGBTQ plus population. We also serve youth, and we provide, my program specifically provides mental health treatment services. For everyone who doesn't know, they're free and confidential counseling services for anyone aligned with the community. So feel free to refer to us. Other than that, I will pass it to Stephen.
Stephen went, so I'm going to pass it along to John.
Hi, everyone. My name is John Cordone. I wear many hats, both literally and figuratively. So I have a visual disability. So I wear my hats to kind of block the glare off the screen and sometimes bright lights that might affect my eyes and the way I see. So if you see the hat, that's why. But as far as my other hats go as roles, I work for UAU as a curriculum coach, and I don't know if it's the word is coordinate, but I lead a few grants that we have here at the prevention department. So I guess that's my role again at UAU. Sean, who do I pass over to?
Let's pass it along to Christopher.
Hello, my name is Christopher Crow. I'm with Sun River Health. I work as a data analyst, so I don't really usually encounter most of the people that come into the clinic, but we do serve a wide range of people, try to serve the underserved specifically, and that goes into the social determinants of health. I'm also a parent of 2 children who have mental health issues that do impact their daily lives. So I kind of like working with this organization. I'm not sure who has not gone yet, since most people.
No worries. Let's pass it along to Christine.
Good morning, I'm Christine Nuzella. I am with the DOE and I have assumed the role of Prevention Director for Staten Island this year. Been with the DOE for quite some time, 31 years, was a teacher, a guidance counselor for many years, an assistant principal, and now I've stepped into this role and I love it. So I will pass on to my colleague, Bruce.
Hi, good morning, everybody. My name is Bruce Monteleon. Like Christine, been with the DOE forever, held a bazillion roles, both school-based, district-wide, citywide, and I am currently serving as the supervisor of school social workers on Staten Island. And in this role, Christine and I think we touch upon nearly all of the bullet points and organizations that I see on the slide, including being parents. So thank you for inviting us. I'm glad to be here. And let's see, is there anybody left that hasn't gone yet?
We can help out. How about I pass it to Shanice?
Thank you so much.
Hi, everyone. My name is Shanice Rodriguez, and I'm a special projects assistant for SIPCW. The communities I present, I think, are youth, and then school, because I'm in my master's program right now to be an English teacher. And yeah, anything else I should say? I think I'm good, right? You're good? Okay, cool. Thank you.
Let's pass it to Elizabeth.
Okay, so hi everybody. My name is Elizabeth. I am the Youth Engagement Manager for NYC Smoke Free, which is a youth and community serving organization that works to reduce the smoking and vaping rates of teens and adults in the 5 boroughs. I specifically represent youth in Staten Island. So I guess my groups would be youth serving orgs, youth substance use services. And then we also partner with other types of groups that work on health disparities, such as the LGBTQ supporting organizations and different diversity organizations in that sense. I'm not sure who didn't go. Let me pass to Maha.
I'm Maha, and I'm a TYSA youth consultant, and I think I would represent in the community youth, and I'm also currently in college, so school as well. Anybody that hasn't gone yet?
Is there anybody left? I think we got. Raise your hand if you haven't gone yet. I think we've got just a
It
minute.
may be everybody, Ashley.
Okay. Okay, great. Great. Well, great. I love the diversity of backgrounds and perspectives that are coming to the room today. So thank you all for being here and sharing the various parts of your identity and work that that brought you here. Moving forward. So as I mentioned earlier, TYSA is a coalition that is part of Staten Island Partnership for Community Wellness, but we are really the backbone of it. Sean and I are the primary staff with assistance from Stephen and Adrian and Shanice, who make sure that all of the kind of planning and coalition building and facilitation is kind of on track for TYSA. But the coalition itself is much bigger. You know, I think we have 80 something partners altogether that are involved in our work. And TYSA, just so you understand kind of the bigger picture perspective of things, TYSA is not the only coalition that Staten Island Partnership for Community Wellness manages. And behavioral health is not the only issue that SAPCW cares about. The agency also works on chronic disease prevention and maternal health programs. It has several other coalitions, such as the Child Wellness Initiative, Project Launch, and Birth Justice Defenders. TYSA, you know, does not really, the work we do in TYSA does not really overlap with these, but we do want everybody joining just to be aware that the behavioral health initiatives we do in TYSA, you know, even though we all meet separately, are part of a larger organization that has all of these different public health goals and aims overall. And with TYSA specifically, the coalition was founded in 2011. We recently had our 10th birthday and had an anniversary celebration last year. The Staten Island Foundation, for those of you who aren't familiar, they are a small but mighty philanthropic organization on Staten Island who they're still involved in our coalition. They funded us initially, and the vision of TYSA was to have this cross-sector collaboration that we just talked about, people coming with different experiences, different niches, and the goal is really to leverage the power of collective impact. So it's all working together to improve health outcomes in our community's youth. At first, we were very focused on substance use, especially since Staten Island was hit so badly by the opiate epidemic, but we've grown to incorporate mental health perspectives, and we continue to grow in our efforts to make sure what we do is inclusive of the needs of the LGBTQ population, BIPOC folks, and immigrant youth, which we recently got a grant to do more work around. So equity and inclusion are really a big part of what we do. I'm not going to read our whole mission. You guys can get a copy of these slides afterwards and you'll see it on our website for time's sake. I'm not going to go through all of it, but just some very quick talking points to remember. Everything we do is data driven. Our strategies are all about collective impact of us all working together. The outcome is to improve behavioral health outcomes using a lens of equity and inclusion. And I'm going to pass it to Stephen so he can share a little bit about some of the data on Staten Island. That's pretty significant, that informs our work. So take it away, Stephen.
Great, thank you so much, Ashley. And so as Ashley said earlier, we look at so much data within the TYSA coalition to really drive a lot of our work. We want to ensure that all of our strategies are, evidence-based and data-driven. So just want to take you through some of the high-level data points that we look to on a regular basis to whether it's from data sources collected by city agencies, by government agencies, by our partners, or collected by ourselves. So some of the first piece of data that I really wanted to highlight this morning was overdose death data that is captured by the New York City New York City agencies. This data actually reflects the report that was just most recently released by the city just a few weeks ago, which highlights the overdose deaths happening in 2021. There's usually a bit of a lag when it comes to the data sources we look at. With this one in particular, it reflects the full calendar year from typically the previous year. So in late 2022, early 2023, we finally got the 2021 data. And what this data is showing and really highlighting is the tremendous rise in overdose death rates across the city. And you can tell from comparing 2021 to about a decade ago, overdose death rates have pretty much quadrupled from during that time span. And if you were to kind of trace some of these lines, so I guess let me back up for a second. Each of these lines is really representing different death rates based on different substances. So you can you see the bold black line at the top, which is really reflecting the overall death rate, but you also see any opioid, which is really in lockstep with it, which really highlights that so many of the overdose deaths across New York City have been driven by opioids. You can also see just how closely the fentanyl line right below the any opioid line has really contributed to that overall overdose death rate and over the last several years, especially since 2015. You see also the cocaine and heroin lines also driving a lot of the overdose death rates as well. And that certainly has to do with fentanyl being within local cocaine and heroin supplies. And so just wanted to highlight that, the biggest spikes in overdose death rates over the last several years has been in that 2015 to 2016 period, really coinciding with the introduction of fentanyl into the drug system that we're seeing today. And again, from 2019 really to 2021, where we've had this kind of unprecedented rise over 2 years of overdose deaths. And likely that has a lot to do with the COVID pandemic as well, where social isolation certainly played a big role in exacerbating overdose deaths. Next slide. So here we begin to try to take a little bit of a closer look at what the what overdoses look like at a local level on the borough level. In this first chart on the left here, you see Staten Island in orange and the New York City trend line in blue. And for the longest time, the Staten Island overdose death rates have actually been well above the New York City average. It's only in this past reporting period in 2021 that we really see New York City catch up with the Staten Island overdose death rates. And that's actually largely driven by just a really scary spike in overdose death rates in the Bronx. For the last several years, maybe about 4 or 5 years ago, it was a little bit back and forth between Staten Island and the Bronx in terms of which borough had the higher overdose death rate. And in the last several years, the Bronx has really surpassed and continues to exhibit high overdose death rates. And so the chart on the left is really highlighting overdose death rates. The smaller chart on the right is showing the sheer number of overdose deaths that are happening. And you can really see, you can really track over 5 years. The green line at the top is the rise in overdose deaths in the Bronx over the last several years. So within the last 5 years, going from 362 up to 786 in 2021. And you can see Staten Island is actually at the bottom here, but that has so much to do with the smaller population size of Staten Island compared to the rest of the boroughs. So even though the sheer number is actually much lower than any of the other boroughs, the rate of overdose deaths has been as alarming, and in fact has increased from 2020 to 2021, just as it has in previous years as well. Next slide. And so we can start to take a bit of a closer look, kind of by neighborhood. This is a map representation of overdose deaths on Staten Island, but really across the city as well. And I wanted to just pull a line from the report that the city had released, that states the most prominent inequity in overdose mortality rates in New York City continues to be by geography, which really reflects the highly segregated nature of the city. You know, a lot of the we see more overdose deaths in neighborhoods that are experiencing inequities and other things as well, in terms of income, wealth, employment, and so many other social factors. And so what this map is really working to highlight are all of the neighborhoods across New York City that have overdose death rates above the New York City average. I have put little arrows as indicators of the Staten Island neighborhoods that have overdose death rates that are in that range above New York City average. And I've also highlighted them over to the side as well. So we can see that Port Richmond, Stapleton St. George, and South Beach Tottenville, these have all been really well above the citywide average for the last several years. And that comes in at number 9, number 13, and number 16 respectively, in terms of overdose death rates across the city. And in this very next slide, we see a little bit of a deeper dive of just thinking about opioid related overdose deaths. Opioid related overdose deaths make up 84% of the total overdose deaths across the city, which again goes to show just how much opioids and fentanyl in particular are driving overdose deaths. A lot of the trends here that we're seeing are mirroring what we just saw in the previous slide as well, that Staten Island neighborhoods in particular are really hit particularly hard when it comes to opioid overdose deaths. And I'm going to go to the next slide. Perfect. So shifting gears a little and moving away from talking about overdose deaths, I did want to highlight some of the surveillance data that TYSA is looking to regularly to plan a lot of our prevention and intervention activities as well. This is YRBS data that is collected among high schoolers across the city, but this is focusing on Staten Island students in particular. So unfortunately, again, it's going to be a trend. There's a lag in the data reporting that we're seeing. So unfortunately, our latest data from this data set is from 2019, and it really puts us at a little bit of a disadvantage because we're still working with pre-pandemic numbers, and we don't really have the full scope just yet of what substance use consumption and substance use issues look like at the high school level for more recent times. The good news for us is that the data collection did happen in the last few years in 2021, the 2021-2022 school year. And so that data should be available for the public and for us very shortly. And so we'll be able to really integrate that data into our planning for strategies and activities. What we see from 2017 to 2019, however, is just that there were increases in usage and consumption patterns of several different substances, whether it's drinking, whether it's alcohol drinking, risky binge drinking behavior, or marijuana use. Surprisingly, for us, we saw vaping come down from 2017 to 2019, which was curious for us just because it was amidst like kind of this expansion of vaping as a trend. What we also saw from 2017 to 2019 was the increase in reported use of prescription drugs, whether it's prescription pain relievers, tranquilizers, or stimulants. And we also saw increases in reported cocaine, heroin, or injected drugs use across lifetime. So these were all certainly very, very troubling for us, and we're trying to, wrap our hands around how we can develop strategies to really address this. Next slide. So here we have data collected from a slightly older target group of 18 to 25-year-olds. TYSA was able to conduct data collection for this during really the height of the pandemic, from the end of 2021 to early 2022. And what we saw was certainly very jarring for us. I mean, there were absolutely limitations to our data collection here. So much of it had to be done virtually, whereas in the past we were able to do a lot of data collection in person. So we, and with that came a little bit of reliability issues when it came to the validity of our data. We ended up getting a lot of what we suspected to be bots that were responding to our survey. So we had to do a couple of filtering techniques to really limit our data sample size here. And so with that said, there's a little bit of an asterisk on the 2021 data. But what we did see in the data that we felt confident in was similarly a rise in a lot of reported consumption of a lot of these substances. And some of them in a way track with what we had been seeing in previous years. But I think one of the really big jarring things for us was to see nearly, or typically more than 1 in 4 respondents saying that they had used prescription pain relievers, prescription stimulants, prescription tranquilizers, or heroin and methamphetamines in the past year, whereas the numbers previously in 2018 were certainly much lower. So just another thing that we're thinking a lot about in across our TYSA work groups. Next slide. And so just to close the data portion of this presentation, TYSA is very much thinking not just substance use, but also broader behavioral health. We've certainly been working to develop strategies to address mental health issues and challenges that our community is facing. Bullying and suicide were are part of that agenda of topics that we're working to address. And so this data here is also from the YRBS highlighting data from high school students. But what we see is that bullying, both in-person and electronic bullying, are higher in Staten Island compared to the rest of New York City. Certainly, that might be a small part of the trends that we're seeing in suicidal ideation and attempted suicide as well. I think what we're seeing there is that perhaps bullying is a small part of the overall set of reasons that might contribute to suicidal behavior, but it's certainly part of the the data set that TYSA is looking at as well. And next slide, which is the final slide that I have for data, is just capturing some of the death by suicide numbers, as well as self-harm, hospitalization, and ER visits data that we have available to us. So all the way to the left are suicide deaths, and it's typical for this data to be grouped by a couple of years. Fortunately, the numbers are typically small enough that doing any 1 year makes it hard to really pull any useful data from. So it's common for several groups or several years of data to be grouped together. And what is notable here is that there were 3 death by suicides among 10 to 19-year-olds during this time span of 2017 to 2019, and 4 among 20 to 24-year-olds. And looking across at hospitalizations and ER visits as well, we actually see a little bit more of the iceberg below what's visual and what's visible as well. We can see we can start to see the scope of the issue when it comes to self-harm within that age group. And I think I just want to close on noting that certainly substance use and suicidality are closely linked to one another. I want to point to the sections on the bottom of hospitalization and ER visits, where almost 2/3 of self-harm hospitalizations were a result of overdose and drug poisoning, and almost 1/3 of self-harm ER visits were a result of overdose and drug poisoning. And it just goes to show how closely linked substance use and mental health are, and how important it is for TYSA to be thinking about behavioral health really as a broad umbrella approach to addressing one. It's hard to address just one without addressing the other. And I'm going to pass it back to the behavioral health managers.
Thank you, Stephen. So Ashley had shared with you all before that we're a coalition, and you see in our graphic that these are some of the sectors we make particular focus on engaging in the coalition. And we'll see in a later slide this socio-ecological model. But we're focusing beyond just individual impact, right? And looking at seeing broad societal change. And that really means engaging sectors, not only engaging young people themselves, but engaging sectors where young people and their families turn for information on behavioral health. So often that's sectors like, healthcare professionals themselves, or their institution of faith. If they're involved in a civic group, we engage with those folks. Of course, schools are pivotal, the business community, the media. So this gives you a sense of, who we try to engage in. Next slide, please. And you'll see this is sort of a distribution of what our current coalition representation looks like. And we've really tried to think beyond those 12 sectors you saw in the previous slide and really engage additional sectors as our funding has changed over the years. We also want to bring in LGBTQ supporting organizations, immigrant supporting organizations, mental health professionals, philanthropy, and many of you all are here today. And this is part of sort of longer term work we're trying to undertake to really bring in the many different areas that help to build a young person's resilience and capacity. Next slide, please. And our coalition really tries to take a collective impact approach. So you see on the left, without the coalition's intervention, what often happens, right, is organizations doing great work, but doing it sort of individually within their structure, within their organization, having impacts, right, but often on like an individual to individual basis, right? But if we can coordinate those, that work, those strategies, and align to the extent we can, right, the work that's happening, we can certainly amplify it and have a greater impact. And there are 5 elements to collective impact work. And that's 1, shared measurement, setting a common agenda, engaging in activities that mutually reinforce one another, right? Remaining in communication at all times. And we try to really keep organizations as much as we can in the loop with one another on the work that's happening. And that goes back to that 5th element, which is like a backbone organization that can really keep one another on target and on goals for these outcomes and these strategies that we've decided we want to see happening within our communities. Next slide, please. So our coalition has some guiding principles that we set early on to really keep us on focus and on target. So that's, for one, population and level impact. Again, you all are doing that work on the individual basis. We don't want to duplicate the wheel. Rather, we want to amplify the work and really see impact across our community, right? So that means that we're looking at making changes on a systemic level, right? Structural changes. And to do that, we really rely on the data, digging through data, seeing where there's gaps, if there are groups that are falling behind and need further services. And we also really try to turn to the research and see what emerging strategies that are evidence-based are new and could be an interesting intervention that's appropriate for our community. Next slide, please. So the coalition, we had guiding principles and a commitment to focus on substance use, but we needed to do work as a coalition to define the problem. And as we learned more about the community through interviews, focus groups, survey collections that we've done over the years, we've really determined where our primary focus is, right? And then also identified other factors that we want to prioritize over time as we sort of build the coalition's capacity. So you'll see many factors there, but like those ones that are circled in green are really some of those critical factors that we're working on. And then you'll see sort of a dotted circle around some other factors. And those are things that are on our radar, and we're working to do more in those areas. Yeah. Next slide, please. So you see here that socio-ecological model I referenced. And so these are the various levels that risk and protective factors are occurring at. So on the left-hand side, we're seeing in red these risk factors. On the right-hand side in green, we're seeing protective factors, and then various levels that they're that we're intervening at, right? So at the individual themselves, across their family, thinking a little bit larger, across their peer group and in their school community, and then at the largest level, right, that broad community impact. And we began to use this model to really identify what risks to decrease, what community assets we wanted to expand, and what areas we had the capacity to influence on. So for example, we knew that increasing alcohol taxes impacts use, but we knew that there was little political will to do that, support an alcohol tax. And so that's sort of lower on our priority list. So this information really informed how we organize, align our efforts, and develop a common framework for change. Next slide, please. And so as any organization that claims to be working on behalf of the community ought to, right? We've evolved over time. Being representatives of the needs of this community means that as new emerging issues come up, we have to reflect that in our work, right? To really be an inclusive and really a group that's speaking for the community as a whole. So we started with a really narrow focus of addressing substance use for 12 to 18-year-olds in 2011. 4 years later, our focus enlarged slightly, and we dedicated ourselves to 5-year-olds substance use. In 2019, we added mental health to our mission. In 2020, we committed in our mission to anti-racism and to doing more to support the LGBTQ young people on our island. And then just last year, we added an additional focus of working with the immigrant population on Staten Island to ensure that we're not leaving those folks behind as well. Next slide, please. So we're going to talk a little bit about the coalition structure. Next slide, please. Next slide. Yes. So here we are seeing a sort of aerial view of all that's happening in the coalition. We'll kind of start on the top right. That dark blue circle there is our steering committee. It meets monthly. And that's where we're really doing, I'll say, thinking strategic planning for the coalition, kind of identifying, really digging into new work that we want to undertake, and thinking broadly about the vision and where this coalition needs to be going and how we need to get there. We have a chair and vice chair of our coalition, Jen Calindris from UAU and Jackie Phyllis from the YMCA. So they represent the coalition within our executive committee. That executive committee meets also once a month, but on a different schedule from our steering, and they really try to maintain the work in between our steering committees. Also within the executive committee is one representative from each of our 6 work groups. So we have the continuum of care, crisis prevention, policy and advocacy, school-based, youth consultants, and data work groups. Each of those chairs, as well as our coalition chair and vice chair and our backbone, meet in the exec. And you've already heard about our backbone. You see them there on the bottom left. And then all throughout, we're really trying to engage the community as well in all of these spaces. Next slide, please. So this is kind of zooming in on those 6 coalitions and the steering. Again, as Ashley said, we're going to be sharing these slides and recording afterwards. So no need to, well, feel free to screenshot it, but no need to scribble it all down. There's work happening in each of these work groups. Some spaces are often maybe a better fit for health providers. Sometimes they're better. There are spaces that are better fits for organizations that work within school communities. But there's really, I think, a space where any community partner can find an appropriate space to really further your work and amplify ours. So if you do find a work group that's within your skill set, or maybe it means that the timing is a good fit for when you have availability in your schedule, but please consider getting involved in a work group, because this is really where our work moves forward. And I think you will find that this is really mutually beneficial for your organization and for the partners at the table. Next slide. And I think I'm going to pass it to Ashley here.
Yes. So I'm going to talk a little bit about how our organization is funded. And this changes, right? I mean, a lot of you are familiar with the way that grants work in the field. They are often time bound. Some renew, some don't. Right now, these are our 4 primary types of funding, that are funding our coalition work. We are a subcontractor with the YMCA in a grant that allows us to do a lot of the awareness work we do, like a lot of the sticker shock campaigns and things that we do around decreasing youth access to alcohol and some youth access to other substance use. So a lot of that work we do, is part of the YMCA grant. We recently got well, for our standards, a relatively large grant from OASAS to start doing more work around special populations. This grant is specific to alcohol and cannabis misuse in particular. And the coalition had identified immigrants, particularly immigrant youth, as a population that's been underserved, by the work we do so far. We really don't have a lot of local data about how alcohol and cannabis use is impacting this population. And we really want the opportunity to make more of our programming a little bit more culturally relevant and linguistically accessible to immigrants who might benefit, from our information, but maybe just need it presented in a way that is, more consistent with their needs. So, we're in the process of doing a needs assessment to get more information about, whether or not, or the degree to which alcohol and cannabis misuse is a concern among immigrant youth, and then we can develop strategies from there. We are also working off of a federal drug-free communities grant. We are in year 10 of 10 of this grant. This grant is not going to be continued because there is a maximum of 10 years, but we've been able to do a lot with this grant while we've had it. We were able to use this grant to engage in projects with a lot of partners to address the behavioral health outcomes that we're wanting to look at, and that's inclusive of both mental health and addiction related outcomes. And we've been able to use a lot of the funding to on our work to reduce prescription drug use, and also marijuana, heroin, and alcohol use. So we've been able to do a lot with that grant since we've had it over the past 10 years. And we also have a grant from the city. This is our camp grant. And the camp grant we have in place is allowing us to do a lot of the work that we're doing with the youth consultants and the Pride Center around LGBTQ youth and is allowing us to focus on looking at a lot of the risk factors, right, that go into making LGBTQ plus youth more likely, to have problems with substance use. And we are able to kind of plan, interventions that address those risk factors and also, enhance the protective factors, right, that help prevent LGBTQ youth from having a substance issue. And a lot of those are, and you'll hear this a lot as you become more involved with the coalition. Some of you might have already, from other prevention settings, but that's a lot of focus on pro-social events, right? And community acceptance, peer acceptance, those are all really, really important protective factors, that we want to help build. So it's not just about preventing the risk factors, but it's about enhancing the protective factors as well. And this grant has been very helpful towards helping us do that. So here's some examples, of strategies that we've used to support some of the and enhance some of the protective factors that we mentioned earlier. So you might remember when Sean showed that chart, that red and green chart, right, with the risk factors on one side, protective factors on the other. One important protective factor in preventing youth from having an addiction concern, or specifically with substances, is having conversations with parents about it, right? Having productive, honest conversations with parents. So in response to that protective factor, the coalition created a Parents You Matter workshop that's designed to be delivered directly to parents. And it basically gives parents the overview of, hey, listen, here's what the drug landscape is like in our community, right? It's sadly, a lot more prevalent, I think, than some parents realize. Here are some reasons why youth might use drugs. And, here's some concrete tips, to prevent youth initiation of use, right? Or here's some concrete tips of how to talk to your kid, if you suspect that there might be an issue. And one of the ways we are applying our collective impact model to this is we are training members of our coalition in delivering this training too, right? So it's not just like Sean and I going out training people. Sean and I do train people, but we want partners to be able to go out there and give the presentations to parents as well. Even parents, right? We have had people, join our coalition that are a parent of somebody impacted by addiction, and they want to show up and do something to help. And, that would be something that we would welcome too, right? Having parents come in and learn the training to give to other parents. So, and we are having a shameless plug, Train the Trainer for Parents You Matter this Thursday at noon. If you're interested, you can email Sean and I, we'll give you the link. But periodically we do hold the sessions to train our partners, and okay, here's how you can go out there, right? Independently and give the training. And if you want one of us as a co-trainer or just kind of be there on on the back end for technical support, we can do that. We are also looking, and we have somebody from who works pretty closely with the Spanish-speaking immigrant community to come and observe the presentation and give feedback about how to make it more culturally relevant to that population, and potentially translating parts of it too. So that's one way where we're kind of weaving a couple of different strategies together to concretely bring something, to the community that enhances protective factors. Another training that we're working on is the QPR training, which stands for Question, Persuade, and Refer. And that training is what we call kind of a suicide gatekeeper training. And that that is also using the collective impact model, because, you know, in addition to having some of our backbone staff, you know, Sean and I are trained on doing the QPR training. We are also, for this, training partners as well to be able to give this training in the community. And this training, you know, it's geared towards, you can do the training to youth directly, or you can do it to staff or anybody, like faith leaders, anybody who is having frequent interactions with youth, to understand, you know, the drug landscape, you know, how it intersects with suicidality and mental health concerns, and basically teaches you how to kind of intervene as a layperson and connect that person to whatever type of professional resources that they need, kind of based on their responses. So that's another way that we are trying to just increase the amount of people in the community who are capable of helping somebody who is in a crisis. We've also worked in our school-based work group, worked to get a lot of the school providers on the same page with like a menu of services outlining what is available. And we've done work with, we've had a couple of pharmacies in our coalition that have been really amazing in working with us to get information to pharmacy customers who are taking prescription opiates or benzodiazepines or other controlled substances, to get information out of them to, you know, A, be aware of the risks of it, you know, B, get information about safe storage. So, you know, ways that they can, you know, lock up or store their prescriptions so that kids can't get to that, because that's a huge problem. And information about things such as, you know, if the medication is no longer needed, where to dispose of it safely and anonymously, so there's not extra medication leaving or, you know, laying around for people to get their hands on. So those are just some examples of some projects and some ways that we have applied this to the community. We also, a couple of years back, Sean was actually the program manager for this at the time, so he was really active in this. We partnered with 126 teachers and 2,755 students on Staten Island to train them in what we call social emotional learning. Some of you may have heard of this before, but social emotional learning is a strategy that teaches students how to do things such as manage stress better, and it teaches them basically how to manage emotions so that they lead to things such as like better self-awareness, better management, better relationships, better decision making. And you'll see this model shows kind of the different layers that social emotional learning interventions can be applied at. And, you know, we really focused on the classroom and schools level, and had quite amount of success with it, you know, for that grant. So that grant is now over, but we still do recognize as a coalition, you know, the you know, importance of social and emotional learning, and, you know, do look forward to other opportunities where we may be able to you know, work with schools and the community to apply that again, because all of these things are important protective factors, right? You know, the self-awareness, relationship skills, you know, ability to regulate emotions. And I am going to pass it over to Shanice for a few minutes to talk about the youth empowerment stuff.
Hi, everyone. So I'm just going to talk a little bit about the different strategies we use to empower young adults. So we use a couple of different strategies to empower the young adults of Staten Island and give them a voice. Things like our sticker shock campaigns or photo voice, also known as zines, allow our young people to take an idea that's brought to them, such as like emerging problems that we're seeing in our communities, like vaping or bullying and harassment or alcohol use. And it allows them to create campaigns that are tailored to young people, and that they feel young people will engage with and interact with. So doing this allows for these emerging issues to be confronted by the very group that's experiencing like the brunt of it. Although there are obviously adults that are experiencing this, we want to give youth a vehicle to be able to create campaigns and things that will directly speak to other young people. And in the last 3 years, we've actually been able to reach 4,000 people with this strategy and have seen how much young people actually want to have these conversations around alcohol, vaping, bullying, and body image. If you look on the screen, there's actually a picture of a zine on vaping that a complete group of young people put together. They talk about things that I don't think a lot of young people are aware of, like pink washing, the fact that big tobacco companies often use LGBTQ representation in their ads in order to give the appearance of their allyship, when in reality, they're just using it to market to specific groups of people. And this was all put together by them. So we presented vaping as the issue and they completely ran with it and like did their own research and did all this themselves. So next slide, please. So we also do a lot of work to prepare young people for the challenges they might face by giving them real world skills to intervene when they see injustice. A great example of this is our bystander intervention training, which gives like young people the skills on how to intervene or de-escalate situations where maybe a friend or a loved one is being bullied, or if they see injustice happening. And this allows for young people to learn safe tactics of intervention that don't involve them physically stepping in for others. That's definitely not what we want to get across, but through this training, it's really important that they understand intervening can look a lot different than what they think. I think they hear like young people can hear intervening and they think putting themselves in harm's way, and that's not what we're trying to train them on. It's more learning tactics on how to de-escalate situations verbally, or maybe diverting the attention of the conflict, directing it somewhere else so that they can prevent someone getting hurt or injustice. So we also recognize youth achievement in our communities through our youth awards. We are currently planning our second annual event. And last year we recognized 5 youth and they were nominated in specific areas such as journalism, arts and culture, health and well-being, community organizing / activism, media and journalism, and education. And we hope to do that again this year to continue recognizing our young people and what they're doing in their communities. Thank you, Ashley. So we are also trying to create cultural change amongst young adults. So through that, we're doing things like substance-free opportunities that young adults can have a good time at and make new friends, but also chipping away at the stigma that young people experience and feel. A great example of this is our paint and mocktail event that we put on in 2021. We plan on doing more of these soon because we had a good turnout and young people had a lot of fun. It was also like right after the height of the pandemic. So I think people were just happy to have in-person like conversations with people. So it was great. We plan on doing that again. And another example of this creating cultural change is focus groups that are led by our youth consultants or other young people. We've had a body image focus group where young people talked at length about things in culture that discourage them or bring on insecurity, like what they see in media, how they often don't see themselves depicted in media, or how specific images are pushed and others are kind of shied away from. Another focus group that we've had is our Euphoria focus group, with which we've had, we're about to have a second one soon. but we hold a virtual focus group that screens clips from Euphoria. For those that don't know, Euphoria is an HBO show that depicts explicit use of drugs and alcohol, but they also touch upon like body image, friendships, family dynamics, the list goes on. But when we screen these clips, we're getting to see young people dissect what's going on and holding conversations about what they find. And a lot through these focus groups, we've often curated sticker campaigns and social media campaigns. For example, the All Bodies Are Good Bodies, kind of putting forward the idea that doesn't matter what you look like, your body is a good body no matter what. I think that's it. I'm going to pass it to Sean.
Thank you, Shanice. And Ashley mentioned it, but I just have to mention again and emphasize that, you know, Shanice was one of the young adults that joined our TYSA Youth Consultants group and is really, you know, this work that we do, this collective impact strategy, she's really taken it on and really her and all of our other young people, you know, they really speak passionately and like sincerely about this work, and it you know, I think we've seen that it has greater impact when it really comes from the young people. So I'm really thankful, Shanice. But to the slide at hand, I just want to also continuing to talk about like the strategies that we undertake, and just emphasize we also want to get folks familiar with just how many drug take-back boxes there are on the island. We've created a resource on our website. There's a QR code that you see on screen. If you scan it, pulls up a landing page where you can look up a map of across the borough, all the places that you can become trained in Narcan or naloxone and potentially save someone's life if they're experiencing an opioid overdose. And there are also drug take-back boxes at many pharmacies across the island. So oftentimes that's one of the common ways that young people get their hands on these substances. There's leftover prescription medications in a medicine cabinet. You no longer need them. They're sort of forgotten about, and someone gets their hands on these things. It's very easy to discard them, destroy them. You don't want to necessarily flush them down the toilet or just put them loose into the garbage can. There are either these take-back boxes, free, anonymous to use, or TYSA has doTERRA medicine disposal bags that we give out where people can throw the pills in, add water, and it dissolves them and it's safe to throw out. So I just want to also make a plug for if any partners ever want doTERRA bags, we can distribute them to your site, and please give them out to folks. Moving along, next slide, please. So we talked a lot about all the work that we've been undertaking, but this work is always evolving as we're bringing in new partners, as new issues emerge in our community. And so, we have our eyes on the future while we're doing the work today. In the near term to longer term, we're really trying to build our mental health capacity. As we said, this coalition has moved beyond just substance use work, and we're really trying to think broadly at behavioral health. And that means we want more mental health partners at the table in our spaces. We also want to build the capacity of the partners we do have. And Ashley mentioned this, we're providing suicide gatekeeper training to many partners. So that's a free training that we can provide. That's about 90 minutes or so. We can do it virtually or in person, and it allows your colleagues, any staff that you have that are working with young people, to pick up on a red flag when it happens. Really, hone in on what you just heard. See if there's a potential threat there. Persuade them to get the help, and do a warm handoff to a professional. We're also, and I think we've talked a lot about this today, but like trying to bring in more folks. So that's more young people, that's more parents, that's more folks serving immigrants or LGBTQ folks, the BIPOC community. We really want folks who, we want credible messengers for our work. And that means really having folks at the table who can amplify and bring the work that we're doing to their communities. And so, lastly, that means like we really have our eye on equity, where when we dig into the data and, Stephen's data review, that was like a shallow wade. We get deep into the data. If you're into that stuff, we have whole work groups that get really deep into data, where we're looking at gaps, where we're looking by demographics, and all of that. So, and all that to the end of seeing which folks we're leaving behind and bringing those folks up to speed. Next slide, please. So we talked about so much, and we want to make sure that we leave you with some avenues where you can plug in. There were, as we mentioned earlier, 6 different work groups. We hope you'll consider participating in one of those. Again, that's really where the work is happening, that then feeds up into the broader coalition. You might consider joining our steering committee. And if folks are interested in that, there's a partnership agreement that your organization can sign, which is not as nothing really too strenuous, but really just a commitment from your organization that you understand the coalition values and that you'll keep information free flowing both ways in a really like collaborative and collective impact mindset. You'll bring that to the table. We hold a number of community events throughout the year, like participating in the St. Patrick's Day Parade, like a recovery walk and health fair that we hold every year to get the community to show up and show solidarity for folks in recovery. So consider joining our community events. We're on social media, and you can follow us at TYSA Network. We're on TikTok, Twitter, Instagram, Facebook, YouTube, maybe other things. I think I covered them all. You can also support our data collection efforts. And, Stephen would be, your point person for that. We're often trying to get data to the extent your organizations can, right? And some organizations have to keep particular data, in-house and confidential, and we understand that. But to the extent data can be shared, right, it's really to the benefit of all when we can get an understanding of issues or gaps or areas that we need to do more work in, right? And to that end, we also are willing to share the data that we have back with you all and with your organizations. Lastly, there's a QR code at the bottom there. Consider scanning it. It will pull up a landing page where you can sign up for our newsletter. We have a nearly monthly newsletter. We try to keep it consistent, where we're really sharing out what's happening at every level in the work group. Next slide. So here you're seeing, once again, the 4 of us that spoke, our emails. We really want you to stay in the loop with us. If you, well, first off, you can expect to get, following this workshop, this orientation, we'll be sending out the slides and a link to the recording. Some folks joined a little late. Maybe you want to share with colleagues. It'll be a YouTube link that you can share with folks. And we'll also be sharing like a one-pager that goes a little bit deeper into the work groups and who to contact if you're interested in any particular work group. So I'm going to pause there. And do any folks have questions on anything for us? Okay, very good. Well, Stephen, Shanice, Ashley, any final words? All right, well, I had some people send me some DMs that they want zines or this or that. So I'll be following up with folks. And again, we'll be sending out some post-orientation materials. Please share them with colleagues. We're certainly happy to have one representative from your organization, but because there's so many different work groups and so many different ways people can plug in, we also encourage you to, share opportunities with your colleagues and really feel free to invite them to other spaces. The more of you, the merrier. So I'll stop there and just thank you all for joining us.
Yep. Thank you all so much. Enjoy the rest of your day, and hope to see you all soon and that you stay involved.
Thank you for having us. It was a great presentation.
Great. Thank you for the feedback.
Thank you.